About e-prescribing on the Auburn Medical Group YouTube channel. Those of you watching this after it's been recorded, you'll notice that I'm interacting with people that you don't see what's going on. It's because I'm reading their chat comments as we're doing this live. If you want to be a part of future live videos from the Auburn Medical Group, be sure to be subscribed to the Auburn Medical Group channel on YouTube, and then mark the little bell icon to set up notifications so you'll know when we start a live video. Oftentimes we'll do them on Monday evenings and sometimes Thursday evenings. A lot of times we'll do them during the business day Pacific time as things come up at the office, or maybe we'll be seeing patients that will be interesting, and we'll actually have the patient visit live on the YouTube channel. So we are talking about Dr. Gawain's article today on his blog. You find it at drgreenknight.com, and there's a link already in the description, so even if you're watching this live, you can go on over and check out the article that he wrote on e-prescribing. He comes to the conclusion, I guess I shouldn't steal his thunder, but we'll go ahead and do that as people are coming in. I'll be greeting people as they come in for the next minute or so, like Norma Jean Green and Butterfly Girl. We do see that you guys are here. We appreciate you coming and joining our conversation. And if you have experience with e-prescribing, either from the patient side or if you're a healthcare professional, go ahead and let us know what your experience has been with it. It's been around for a while now, and many doctors have integrated e-prescribing before they even get an electronic medical record. We have Brianna McMillan saying good evening from Arkansas. Marcela Gonzalez, hola, saludos desde Chile. So I guess that's hello, greetings from Chile, which I'm guessing would be Spanish. E-prescribing, being able to write for prescriptions through the internet, going directly to the pharmacy, not using a fax machine, not using email, a secure connection just for pharmacies. Also, we have greetings from Pamela Schramke in Indianapolis, and Marian Francisco from Toronto. Kim Perot says hello, and Rachel Ledoux also, all out there. Hello, everybody. And Chrissy Poo. ERX has been with us a while now. Works, but. And Chrissy Poo loves our channel. Thank you, Chrissy Poo. We appreciate that. E-prescribing for me has been overall positive. I will say that. And then for my patients too. Dr. Gawain, I believe also he would confirm overall positive, even though I believe the title of his article is Dangers of it, but I think overall he prefers it. It allows us to not have to handwrite with all of the errors of reading. Actually, he didn't mention that in the article. He didn't mention how there's errors in pharmacists transcribing what's on the prescription as they put it into their system and write it for the patient. There's errors that can occur there, and that's eliminated. They get exactly what the doctor wrote. So if there's a mistake, it happened at the doctor's end, which you would have if it was on paper anyway. So it actually does take away a step of possible introduction of error. It also adds in the ability on the doctor's side to catch things like allergies. If the patient has had a medicine in the same class as what you're writing for, it had allergic reaction, an alert comes up to let you know, hey, do you want to prescribe Ramipril when this patient had a bad reaction to lisinopril? Something like that. It also can run checks with interactions between medicines. For example, if you have a patient who's on a blood thinner like warfarin and has one of the many medicines, or maybe they're already on warfarin and you're starting them on, say, an antibiotic, and many antibiotics have interactions with warfarin, that reminds you that you need to check their blood test in a few days to see if their anticoagulation needs to be adjusted according to that medicine to make up for any error that is introduced by that. So I see a lot of positive things. And then he's specifically talking about its use in controlled prescriptions, controlled substances, narcotics, opiates, benzodiazepines, sleep agents, things that have potential for abuse. People use them too much, they get addicted to them, they use them improperly, they sell them, they trade them. These are controlled substances, and with e-prescribing with controlled substances, he goes through and describes the process in his blog post about how you put in the prescription, tell it to send it to the pharmacy, and ask for two-factor identification or two-factor authentication, which is where you have to have a code that is renewed every 30 minutes, somehow tied with your identity. So you'll have your own little app that only you can get into because either you are the only person who knows the password or it actually uses a biometric like a thumbprint. or I suppose with the new iPhones, they'll probably be able to work with the face identification. So very low risk for somebody else to be able to get a hold of that. And if they did, there's a record of it because it's associated with your identification. So you're going to hear about it if that were to happen, which is very unlikely. All right, we'll take a moment here and see what Marion's writing about, because he writes lots of stuff in his little comment here. A big fan of the e-prescription, had a handful of instances where wait times at the pharmacy were longer than normal because pharmacists couldn't read what the doctor had written. Yeah, with e-prescribing, they actually have it in their office, in their pharmacy, in their computer, before the patient checks out of the doctor's office. Now, does that mean you get the prescription quicker? Well, not at the chain pharmacies that are associated with drugstores. Those drugstores have very low prices on a lot of prescriptions. In fact, lower than they cost them sometimes to get you to come in to their store and pharmacy. It does bring people in because you have to come in every month or every 90 days to get your prescription. That's you in their store, where you have lots of stuff to sell them that the customer needs every 30 or 90 days. They get used to shopping at your store. But not if they just give you the prescription so you can get it and leave. They have to get you in the habit of buying from their store. So they do not give you your prescription when you come in. They tell you it will be ready. Probably what's happening is they're not even starting to fill it until you actually come to the pharmacy and present in front of them in person, so that they know that you're going to get it. So that way they're not filling prescriptions that never get picked up, because that would be wasteful. But they also make you shop in their store, because what are you going to do for that 10 or 15 minutes while you're in a Target or a Rite Aid or a CVS or a Walgreens? You're going to shop around. There's nothing else to do while you're there. So that's what's going on there. A lot of times doctors' offices will get blamed for not getting the prescription to where it's going and e-prescribing. Not the case. It's in their system. When we write the prescription, they want you to shop in their store. Now, if it's happening at a standalone pharmacy, which, where do you find one of those these days? Then, okay, I guess there might be something in the system, but I don't know of that happening. Aaron points out, a thumbprint, in addition to not making disabled and elderly and terminally ill having to sit around the pharmacy, especially those who are immune suppressed. I think you want to say suppressed. Yeah, I agree. And also, we have Aaron Peters saying, PA e-prescribes all medications, including narcotics. It's been beneficial, as in insurance reporting and stringent pharmacy policy. That's right. Now, Dr. Gawain points out, his whole point of his article is that it might be a little too easy to make these controlled prescriptions because of e-prescribing, and you don't have to handwrite the prescription. I disagree. I do not see that. He equates it to being like spending money using a credit card, how it's easier than if you have that pain of doling out the cash. He thinks it's easier to write the prescription when you just do it through the computer rather than having to hand write out the whole thing. Yes, that does take time, and it does potentially introduce error, but there's much more control. He talks about the old days when there were triplicates and one copy went to some state agency. It was paper. Nobody was doing a whole lot of monitoring of what's going on. Electronically, we have a lot of record keeping going on. We have a new system, at least here in California, called Cures, where there's an electronic database that you check before you write a prescription. He left this out in his blog, by the way. Dr. Gawain left out the part about Cures. So we are required to look on Cures to see if this patient has had prescriptions written for these controlled substances other than what we know they're getting from us. And if we see irresponsible use, then you cannot responsibly prescribe these, continue prescribing this to this patient. So responsible doctors are going to cut off a patient who is doctor shopping or just medication seeking. These are a couple of terms we use for when we see, without them telling us, oh, you're getting a prescription from the urgent care or from the emergency department and going to different pharmacies and filling them. We have a way of tracking that now in California, and that's Cures. And so in our practice, I'm trying to think if I've even seen, I guess I have in the last 2 or 3 years that we've had Cures. I guess I have seen it. But it's so rare in a private practice like ours, where we know our patients and there's this relationship. It's not anonymous in our office. We know our patients and they know us, so it's kind of hard to have that happen. But we have seen a case or two in the last couple of years, and with the old system, I just don't know if that would get caught. So he's talking about risk of it being too easy to prescribe, doctors maybe being more likely to prescribe. This overall, I see it as good. I see it as a way to keep more of an eye on things by having the digital record. I'm much more happy with it. I think I'm more positive toward it than he was in his blog post. And maybe he'll come on and tell us what he thinks. We have some comments here. Pamela is saying, I don't know how docs are e-prescribing narcotics. They have to be presented in paper form. For every month they can look at, see what we have filed in Indiana. Can't speak for Indiana, but we don't do paper in California. Teresa, Texas had that for a while. Aaron, apologies, spell check. Teresa, been at the same pharmacy 15 plus years. They know what I take. And dropping down to the most recent comments, Petra Rosenberg, good morning in Sweden. Good to see that you're up at 5:22. Pamela, docs know if doctor shopping is occurring here in our state. And we do here too with our Cures system, and other states have it. Chrissy Poo, Cures was a prob for my hospice patients, multiple hospice docs as well as attending, but we all adjusted. Yeah, anytime a new technology comes out, you have to work out the kinks in it and make it work. We're pretty much at a good spot now, though. And of course, you have those problems with paper too. If you're at a single pharmacy and you're getting prescriptions from multiple doctors, that's going to be a problem. That's not just the electronic. Pamela, we only do paper for narcotics, at least higher level. And we did too until we had the integrated e-prescribing system, which we're very happy with. Miranda, have to have paper scripts for narcotics in Iowa as well. And some of you people that are experiencing having, or even in an office, working in an office and having to have paper, like I said, we also had that in our office until we got the system that allowed us to get past that. We had to have an electronic medical record set up that had that capability for us to make that jump. That may be the same thing in your office, that you need to have a different system come in to allow you to do that with controlled prescriptions, because that requires the two-factor identification, which we get through the local hospital system. We would not have it, we're not for our relationship with our local hospital system and getting our electronic medical record through them, connected with them. Aaron Peters, waiting for the Cure-like system. This will help in hospital care. Pamela Schramke, I wish my doc could just e-prescribe everything. Chrissy Poo, asking about the hospice, and Petra Rosenberg, we only got e-prescription in Sweden. That's interesting, learning what other countries have. I didn't know what was up. I thought probably Sweden would. Sweden seems to be pretty advanced when it comes to integrating the digital systems with their healthcare systems. You guys have been great with good discussion here. I encourage you all to actually subscribe to Dr. Green Knight's blog at drgreenknight.com. Also, to make sure that you get emails with updates from us. We don't do it that often, but we do on occasion. It's at Auburn Medical Group. There's a little place to sign up for updates at auburnmedicalgroup.com. Those of you on Patreon are probably getting everything through that already, but I encourage you to do it anyway. A couple more comments here. Pamela, I can see why that would be difficult in hospice because any number of docs can see the same patient, yet they work together on care. Usually in hospice, you're not really going to be having controlled prescriptions come from more than one. You can, but usually that's all done through one, at least the way we do hospice here. Petra, the papers disappeared in 2000, very much ahead of what we've been doing here. And Ruthie Fassold, can't get e-prescription here in constant pain from spine deteriorating, I guess that's deteriorating. Has to go see a doctor every month to get my prescription. Well, we require controlled prescriptions. We require the patients come in every 30 days. We keep a very close eye on controlled substances in our office. And that's just good practice with what's going on with controlled substances. You need to be on top of it because the abuse is so rampant. So that's why we have people come in. This is 2 months in use at my practice. Quite relieved. Feel as if I have a team in my specialty of oncology. Pamela, okay. So what makes it more difficult for hospice then? Thank you for touching on this every 30 days as well. Okay. thank you, everybody. We got some good videos coming out for you. Thank you for watching and commenting and sharing. We appreciate that. And those of you who are watching them on Amazon, that's really cool. I appreciate that too. That actually really helps out the whole process, the whole production capability. You guys watching it on Amazon instead of YouTube, because YouTube is not as friendly to the creators, although it certainly does get us lots of audience, so we do appreciate that about it. And yes, Chrissy Poo, you're welcome. And Petra, sending them online, you bet. And Kim W, thank me. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.